Welcome back, everybody, for another deep dive with us. This time, we're going to get into something pretty fascinating and honestly a bit tricky in the world of medicine.
Yeah, it's definitely a tough one.
We're talking about pulmonary embolisms. You might know them as PEs,
Right.
and specifically when they happen during pregnancy.
Oh, now you're talking complicated.
Because, as I'm sure many of you know, a lot of the symptoms of a PE, they kind of look like, well, just being pregnant.
Exactly. That's what makes it such a challenge.
So we're diving into this excerpt from UpToDate called, get this, Diagnosis of Pulmonary Embolism in Pregnancy. And it is written for doctors.
Which is great because we get to see the nitty-gritty.
The inside scoop.
But that also means we're going to be doing a little translating today.
Exactly. Taking that medical jargon and making it make sense for everyone. By the end of this deep dive, you will be armed with all the knowledge you need to understand just how doctors diagnose this life-threatening condition during pregnancy.
A condition that, unfortunately, is a leading cause of maternal mortality.
It's true, and it's something that we really need to be aware of and talking about more, but, like we were saying, it's not always easy to spot. I mean, this up-to-date document doesn't beat around the bush. It actually says, diagnosing a PE during pregnancy, it's almost like trying to find a needle in a haystack.
Well, it's because pregnancy already causes so many changes in the body, and unfortunately, a lot of those changes can mimic what a PE looks like.
You're totally right. It's like your body is going through this massive transformation.
Right.
Everything's different.
You're breathing faster, your blood volume's increased, your heart's working over time.
It's wild.
Yeah.
And a lot of those changes, like shortness of breath, that's also a potential red flag for PE.
Yeah.
So how do you tell the difference, right? How does a doctor know if someone's just experiencing, like, normal pregnancy breathlessness,
Exactly.
or if something more serious is going on?
That's the million-dollar question, and it's a really fine line. Because on the one hand, you don't want to miss a PE. Those can be devastating.
Absolutely.
But you also don't want to overreact to every single case of pregnancy-related breathlessness.
Right. You don't want to be over-treating.
Right. That just leads to unnecessary interventions, anxiety for the mother.
Stress for everybody.
It's all about finding that balance.
Finding that sweet spot.
Excellent.
And that is where things get really interesting. So we know doctors need more than just a stethoscope to figure this out. What else are they looking at? This up-to-date document mentions lab tests, imaging, but I'm guessing those aren't always so simple either, huh?
You're right. Pregnancy throws a wrench in those two.
Figures.
It makes those results a lot harder to interpret.
So let's start with the lab tests. There's one in here called the D-dimer test.
Ah, yes.
Does that ring a bell?
D-dimer? Yeah.
I feel I've heard of it, but I couldn't tell you what it is.
Right. So it's a blood test.
Okay.
And basically, D-dimer is a protein fragment. It's released into your bloodstream when a blood clot breaks down.
Okay.
So if you have a high level of D-dimer, it could mean that you have a clot somewhere, maybe a PE.
Okay, so that makes sense. But then this is where the pregnancy part comes in.
Exactly, that's where it gets tricky because D-dimer levels, they naturally increase during a normal pregnancy anyway.
Oh, see, now that's not fair.
Right.
So you could have a high D-dimer, and it could be a huge red flag, or it could just be your body doing its thing.
It's true. Which is why a D-dimer test can never be used alone to diagnose a PE in pregnancy. It's one small piece of a much larger puzzle.
I see. So it's not a magic bullet.
No, not at all. Doctors are going to look at the woman's symptoms, her medical history, other test results, everything.
Okay, so D-dimer is tricky. What about other lab tests? And what about actually seeing the PE? I know they have scans for that, but those can't be risk-free during pregnancy.
You're absolutely right. Imaging techniques are sort of the gold standard when it comes to actually visualizing a PE, but they're not without their own challenges, especially during pregnancy. So there are two main types of lung scans that are used to diagnose a PE, a VQ scan, and then a CT scan. And usually it's a specific type of CT scan called a CT pulmonary angiography.
Catchy name.
Right.
CTPA. So for our listeners, just so we're clear, CTPA, that's just a fancy way of saying a specialized type of CT scan that's focused on the blood vessels in your lungs. And CT scans, I mean, we've all heard of those. They use X-rays to create pictures, very detailed pictures of the inside of your body. So obviously that's helpful when you're trying to find a blood clot, right?
Exactly.
But you did mention the radiation.
Right. So CT scans do expose both the mother and the fetus to radiation.
And they try to avoid that during pregnancy as much as possible.
Exactly. Which is why they often start with just a chest X-ray just to even see if a CT scan is needed.
Okay, that makes sense. Now, you also mentioned these VQ scans.
Yes.
What are those?
So VQ scans, they use a very small amount of radioactive material. And what they do is they actually track airflow and blood flow in your lungs.
Interesting. So they can see where things are moving, where they're not moving.
Exactly. And that's really helpful because, if you think about it, if you're looking for a blockage, you want to see where things are backing up.
Right, like a traffic jam in your lungs.
Exactly. And the best part, well, not the best part, but a good part, is that it is a much lower dose of radiation than a CT scan.
So safer during pregnancy.
Exactly. Exactly. However, they're not as detailed as CT scans. And sometimes the results can be difficult to interpret, especially if that chest x-ray showed any kind of abnormalities.
Oh, I see. So again, another trade-off.
Right. Less risk with the VQ scan, but potentially less accurate results.
Okay, so it really is judgment call then.
Absolutely. And that's where the doctor's expertise is really critical. They have to weigh these potential risks and benefits for both the mother and the baby.
It just seems like there's a lot of gray area in this whole process. Like, how do they decide when the answers aren't always so clear-cut?
Yeah. Well, that's where, a doctor's expertise and their training, years of experience, looking at the latest research, all of that comes into play.
Right, they use their judgment.
Exactly. And this is also why, that communication between the doctor and the expectant mother is so important.
Oh, absolutely. And I noticed that the UpToDate document actually really emphasizes that. It even says clear communication
Yeah.
a few times. This isn't just the doctor saying, okay, this is what we're doing. They really need to be listening to their patients.
Absolutely. Considering all the factors,
The individual risk factors.
Yes, right,
And
exactly.
explaining things in a way that makes sense.
Speaking of risk factors, are there certain things that might make someone more likely to develop a PE besides just being pregnant in the first place?
Yeah, that's such a good question. And the answer is yes, there are. So pregnancy in and of itself already increases your risk of developing a PE.
Right, just by being pregnant.
But then there are certain things that can really amplify that risk even further.
Okay, like what?
Yeah.
What are some examples? So things like if you've had a previous blood clot, certain inherited clotting disorders, recent surgery, even just prolonged immobility.
So like you were on a really long flight or you were on bed rest for whatever reason.
Exactly. Even things like heart disease or cancer can increase your risk.
So if you have one or more of those things and you're pregnant, your doctor's probably going to be like, okay, we're going to be extra, extra careful about this.
Absolutely. They're going to be watching very closely. And this is really where that open communication comes in again. Because if you know you have one of these risk factors, it's really important to tell your doctor.
Right, even if it's something that you think they should already know.
Exactly. Because it all helps them paint a more complete picture of what's going on.
That's like putting a puzzle together.
Exactly. Exactly.
Well, I have to say, it sounds like in these situations, knowledge is power.
It really is.
If you know the risks, if you know the symptoms, you feel more empowered to speak up if something seems off.
Exactly. And on that note, the UpToDate document actually does offer us a little bit of hope for the future because it mentions that researchers are working hard to develop more accurate and less invasive diagnostic tests,
Oh, interesting.
especially for pregnant women. So
Mhm.
imagine a world where maybe a simple blood test could tell you definitively whether or not you had a PE.
Wow, that would be amazing. No more scans, no more radiation, no more worry.
Exactly.
But until we get there, I guess we have to rely on the tools that we have.
Absolutely. We have to be our own best advocates, pay attention to our bodies, ask our doctors questions, and just really not hesitate to get medical attention if something feels off.
I think that's really great advice for anything health-related, honestly.
Absolutely.
Well, there you have it. We've waded into the murky waters of diagnosing a PE during pregnancy.
We really have.
And I have to say, I feel like we've emerged with a much better understanding. It's definitely complicated.
It is complex, but when you break it down, it's like solving a medical mystery.
Yeah.
Every symptom, every lab result, every scan is a clue.
That's a great way to look at it.
And it just requires careful observation, a lot of thoughtful interpretation, and like we said, that really close collaboration between a doctor and their patient.
And I think the takeaway for our listeners, for everyone out there, if you're ever concerned about PE, especially if you're pregnant, talk to your doctor. Ask those questions.
Don't be afraid to advocate for yourself.
Exactly. Knowledge is power. Thanks for diving deep with us.